All right, great. And we do know, obviously, we've been seeing this rise. We've been talking about it, for weeks, how early we're seeing this RSV, this flu. And now you've got, next week, a lot of people are going to start traveling, are going to start gathering. So how do we make sure that we, protect our families and keep them safe?
That's a great question, Elizabeth. And it's something that I'm thinking about. My kids have been chronically sick. They were sick in October, they were sick in November, and I feel like I finally have a break and I'm just holding on to that. So we're trying to do everything that we can in our household, ourselves safe, my husband and I, as well as my children. And we're really going back to those pandemic social distancing measures that kept us safe all these years. We're thinking about social distancing, making sure that we're wearing masks when we're sick or when we're around other people, and making sure that we're doing everything we can to keep our hands clean by hand washing throughout the entire day. And I would really, really pay attention to your children, making sure that if they go to school and they're sick, they have that runny nose, they have the cough, that you may want to consider putting a mask on them so they're not exposing other people to germs. A lot of us are traveling, including me, this Thanksgiving holiday. We're going on an airplane. So what does that mean for us? We're going to be thinking about wearing a mask and making sure that we're washing our hands, keeping that hand sanitizer with us, and disinfecting surfaces. Going back to all those pandemic measures, which have kept us safe and which will continue to do so. We
And
need to really pay attention to our elderly parents and family members who are going to be gathering with this holiday to try to keep them safe. And these are the ways we can do it.
And to that point, I want to mention, a lot of times we think of RSV and we think of our little, vulnerable babies, right? Because oftentimes those are, the horror stories that we hear. But this can also, RSV, have some serious implications for seniors or people with underlying health conditions as well.
Absolutely. We think of RSV as a disease for kids because we don't see it affecting our elderly population as much, but it does affect them just as much, just in a different way. So with babies, we typically see a lot of nasal congestion. These kids have chronic runny nose, they're having difficulty clearing their secretions. For babies that are taking a bottle, they can't drink their milk, they're not able to get the fluid that they need, they're getting dehydrated, and they're going to the hospital as a result. In elderly people, it's a little bit different. They're not having that chronic nasal congestion. They're able to breathe through their mouth, they're able to eat food. So you don't see that same level of dehydration. But we still do see that these patients are having pneumonias, they're going into the emergency room with respiratory distress. So it does need to be taken seriously. If your kids are sick with RSV, keep them away from your elderly family members and friends to make sure that you're protecting them this holiday season.